Hi everyone, welcome back to my channel. For those of you who don't know me, my name is Lucy and I'm a 4th year medical student at the University of Nottingham. In today's video, I am going to give you a medical school mock interview. This video is going to be in the multiple mini interview style, so the MMI style of medical school interview. And basically you'll probably know that most medical schools use this format and they will have between sort of like 6 and 8-ish stations, each one with a different theme. And basically in your interview, you will rotate around these 6 to 8 stations, and in between each one, you normally have sort of like a minute break or something like that, where you will read a piece of paper that will sort of tell you what the next station is going to be. So it might have a scenario on it, or it might have sort of the theme of the station on it, just to get you thinking before you then go into the station. Each of the stations normally lasts sort of like a few minutes, so maybe like 6 minutes, 7 minutes, 8 minutes. So yeah, basically I'm going to give you a mock interview. We are going to do 8, sort of 7, sort of 8 stations together. So how this video is going to work is I will first flash onto the screen the title of the station or the scenario like you would get in an MMI interview. So you will see what the station you're about to do is going to be about. So you can pause the video and take a minute to think about what sort of things you might talk about, what you might say, and then resume the video, and I will ask you the main question and then maybe some follow-up questions as well. Obviously I can't hear what you're saying, so I can't react to what you're saying, but I have an idea of a few sort of questions that could get thrown back at you. And then what would be really helpful for you to do is pause the video and actually practice saying your answer out loud. And this is really important because although you might feel like you have loads of ideas of what you'd say, when you come to actually articulate things, sometimes, you can trip up on your words a bit, you can struggle a bit, you can lose your train of thought. So actually practice answering my questions out loud. And I know it's a bit weird because you're talking to your laptop screen, but I really think it's important to get this practice. I barely had any mock interview practice at all before I went to my interviews, and it was quite daunting. So I just really wanted to make this video to hopefully help some of you if you're in that same position, just have a bit of experience of answering questions. So yeah, we'll rotate around all of the stations. If you want, you can get up from your chair, you can take a lap of the room, sit back down again so you can feel like you're rotating to the next station. And at the end of each station, I will give you sort of a model answer, examples of things you could say that will come across really well, and yeah, any points that I think were important for you to raise in that station. So without further ado, let's go. Okay, so please could you tell me why you want to study medicine? From what you've said in your answer, it sounds like a career in nursing could also satisfy those things. So why have you chosen medicine over, let's say, nursing? How do you know that your decision to study medicine has been well informed? Okay, so hopefully you've had a go at answering those questions, or if not, then let's just go through things you could have said. So first of all, why do you want to study medicine? It is one of the most difficult questions to answer because it's so hard to not just say something that's really, really cliched. So the thing that everybody says is they love science and they want to study the human body in more depth, and also that they love working with people, they love interaction with other people, so they thought medicine was the perfect combination of those two things. And yeah, that probably is your reason, but try and be a bit more original in your answer if you possibly can. And I think 3 fundamental things for you to get across when answering this question is, number 1, that you actually understand the role of a doctor and you know the pros and the cons of being a doctor, and you know what the working day life will actually be like, that you have experienced and enjoyed caring for people or having interaction with people, and 3, that you have a passion for the lifelong learning of science. So the way that you can actually demonstrate this in your answer, rather than just stating I enjoy working with people, give genuine personal examples of the way that you've demonstrated that. So you could say something like, I would like to study medicine because I have a fascination with the human body, and I've also thoroughly enjoyed any role that I've had that is really interacting with people and caring for people. For example, I had a Saturday job where I worked with disabled children, and I found it incredibly rewarding to spend time with the children and get to know them and help them carry out their personal needs. And I just found that I really thrived in that environment. But obviously use your own examples and expand on the things that are really important to you about working as a doctor. So the next question, why not nursing? This is another big one which can throw a lot of people, and there are some really common pitfalls that you need to make sure you don't fall into. So you definitely shouldn't say that the role of a doctor is superior to the role of a nurse in any way. So you should not say that doctors are in charge of everything, doctors do all of the prescribing, doctors do all of the diagnosing. You really need to show an appreciation for the multidisciplinary team, and you need to acknowledge that a nurse is a really important person in that team. And nurses can also prescribe, so don't fall into the trap of saying that they can't do that, because it will make you look very naive. For me, I think there's kind of two big differences between a doctor and a nurse, which I would suggest are kind of safe things to talk about in interview. So the first is that as a medical student, as opposed to a nursing student, you will learn a lot more about the biology behind diseases, and you will go into a lot more depth in the actual science behind it and the sort of theory behind it. Obviously, your course is 2 to 3 years longer than a nursing degree, so you are going into more depth. Another thing to say is that doctors do hold the ultimate responsibility for a patient. So while they are not making decisions by themselves and ignoring other team members, at the end of the day, the final decision does lie with the doctor. So there is that slight increase in sort of responsibility. So they're two things that you could sort of safely talk about, but obviously if you have your own ideas, then definitely talk about them as well. Just make sure you've thoroughly researched, or you've seen in work experience, the role of a nurse and the role of other healthcare professionals like physios, pharmacists, dietitians, because you never want to belittle their roles, because all of the roles are extremely important in healthcare, and doctors are by no means superior or more important than any of the other roles. So for the final question on this station, so how do you know your decision to study medicine is well informed? So here again, it's another chance for you to talk about your work experience and what you've actually learned over the years about being a doctor. This would also be a good opportunity to talk about some of the sort of downsides of being a doctor. So for example, saying that you are aware that some of the hours that doctors work aren't very sociable, and it's a very emotionally demanding career to go into. It will entail lifelong learning, so you're always going to be building on your knowledge throughout your whole career, but that despite this, you still think it will be the career for you, so maybe because you really enjoy the process of learning. So I would like you to give me an example of a time when you have used your communication skills to solve a problem or to avert a disaster happening. Why do you think communication skills are so important for doctors? So hopefully you've had a chance to think of an answer or say your answer out loud. So let's go through the first question. So this is something I really wanted to emphasize in this video. There is definitely the chance that you will be asked to give an example of a time when you have shown a particular attribute. So it might be communication skills, empathy, leadership, teamwork, good organisation skills, prioritisation skills. It could be anything. But you need to think about what the attributes are that a doctor would need to have, and you need to come up with some examples of times when you have demonstrated those attributes. There's no good just saying, well, I am good at communicating, or I am just empathetic, because you need to have those examples to back up what you're saying. First thing that can happen is you get asked to give an example of something and you literally just can't think of an example. Even if there are tons of times when you've shown that particular attribute, it can be hard to come up with things on the spot. So have a few examples up your sleeve. And why are communication skills important for doctors? Well, you could say so many things here, but it's important to kind of think widely about this. So it's not just that doctors talk to patients and ask them questions. Obviously, it's important that they need to be able to ask open and closed questions to get information out of patients, but they also need to be able to explain difficult scientific concepts to patients in a way they will understand, explain diseases to patients. They need to be able to break bad news to patients, break bad news to patients' families. They need to be able to speak with all sorts of different people, regardless of their background. They might be elderly, they might have hearing loss, they might be a young child, English might not be their first language. They need to also be able to communicate with other people in the healthcare team, so they need to be able to talk to other doctors and nurses and physios and pharmacists, etc., about patients and efficiently convey information in a way that other people can understand. And also, if you really wanted to show off here, you could also talk about non-verbal communication, so the importance of sort of making eye contact with patients and showing signs that you're actively listening to them. They're all really important skills for doctors, and they basically make the patient experience so much nicer. They make patients feel like they're being listened to, they're being understood, they make patients feel like they can open up to doctors. So basically, the better you are at communicating, the likelihood is the better doctor you will be. Okay, so hopefully you have read the scenario before you've come into the station. I'd like you to tell me the issues around this scenario, and if you were the doctor in this scenario, how might you initially respond? Okay, so you should definitely prepare for an ethics station in your interview, and don't worry, you don't have to be an expert at medical ethics. You will learn about medical ethics throughout medical school, but what you need to be really clear of is that there's often not just a single right answer. There will definitely be things that you really shouldn't do in a situation, but generally it's just more about you talking about the issues rather than you coming to a solution. And if you haven't heard about the 4 pillars of medical ethics before, then basically they are beneficence, which is do good to patients, non-maleficence, so do not harm patients, justice, so everyone should be treated equally, and autonomy, so patients have the right to make decisions for themselves. So for this scenario, you can sort of apply some of these pillars. So I would first talk about the issues, and that is that if a patient isn't going to take their medication, they're refusing to take it, there's obviously going to be risks to their health. That is the key issue. The other issue you want to think about is, why is it that this patient isn't taking their medication? Is it that there is something that is stopping them from taking it? Are they too nervous to take it? Do they have some kind of anxiety about the medication? Is it that they've read on the internet somewhere that they shouldn't be taking it, so they don't want to? Is it that they don't feel that they're really ill, so they don't think they need the medication? And any of those could be explained by the patient not being properly educated about their medication or not being communicated how to take their medication. And if you wanted to apply the pillars of medical ethics to this scenario, then you could definitely draw in beneficence. So your job as a doctor is to do good for patients. And for this particular patient, it might be that working in the best interest of the patient means trying to sort of persuade them to take their medication so that they will have less health risk and have less symptoms. However, you also need to consider autonomy, and that is that patients have a right to decide. And a patient can always refuse treatment. So if a patient doesn't want to take treatment, you cannot force them. The only way where you might be able to force someone to take medication is if you don't believe that they have capacity to make a decision. But on the whole, you cannot make people take medication. They have a right to choose to not take it. So in terms of approaching this situation as a doctor, some things that you could talk about is that you would firstly ask the patient why they're not taking it and really try to get an understanding of why they don't want the medication. And you might find that there is something very simple that you can do to then put their mind at ease, and they will then take it. So if it is that they are anxious about how to use an inhaler, maybe they need you to show them again how to use the inhaler, and then they will be happy to take it. If they are adamant that they will not take the medication, then you just need to make sure that they are making an informed decision. So you need to give them all the information they need to be able to be sure that they want to refuse to take the medication. So you need to tell them what the medication does, what the risks would be if they don't take it, what could potentially happen if they don't take it in the long term, and make sure the patient is aware of that. But ultimately, don't worry about coming up with a solution to this issue. You just need to sort of show that you have an understanding of the issues and you have some ideas of things that you could do. So I'd like to ask you how you cope with stress. Can you give me an example of a time when you used that coping mechanism? How would you apply your coping mechanisms to medical school? Okay, so these questions were a bit difficult for me to ask because obviously it will depend on what you've said. But essentially this is testing your suitability for medical school. So will you be able to cope with the demands of a medical school course? There is obviously no right answer here. Everyone has their different methods of coping with stress. But what I think would be really nice and a good way to answer this question is to draw on examples. So for example, you could say that you have definitely experienced stressful times before. For example, when you were studying for your A-levels, what I did is I always made sure that whenever I was planning my studying or my revision, I would always have some downtime scheduled into my timetable. So I would always make sure I took some time out to relax. I would go running and I felt that really relieved my stress. I've also used yoga as a sort of an escape from the stressful environment, and so you could then say that you would continue your regular yoga practice at medical school. You would always schedule in that time to be away from studying and to just completely relax. You would always make sure that you had someone you knew you could contact, so if you did get really overwhelmed and really stressed, you would have someone to go to talk to. So basically whatever works for you is the right answer here, but you just need to demonstrate that you have thought about how the course might be very stressful, and you've thought about how it might be very emotionally demanding as well, and it might take up a lot of your time, and that you do have some coping mechanisms to be able to deal with that. So I would like you to please tell me about your work experience. What has your work experience taught you about yourself? Okay, so the work experience station. This one is very likely to come up, I think. And basically, you just need to practice being able to concisely summarize your work experience without rambling on and on and on about all the things that you did and all the things you saw. And you need to skip past that bit and you need to get straight into what you actually gained from the experience. So for example, I might say, I volunteered at a care home for the elderly for 6 months, and while I was there, I was in charge of running activities for the residents. Done. That's one sentence. You're just going to summarize it quickly and then you're going to go into what you gained, because that is the really important bit. So you might say that while I was running the activities, I definitely gained some sort of more self-confidence in speaking publicly, as I would often have to speak to a room of all of the residents. I also noticed how I would have to adapt my communication skills for different residents. Maybe if they were slightly more forgetful or if they had some hearing loss, I would have to adapt the way I spoke and make sure I spoke at their level. I also really noticed the importance of listening, and I noticed how residents reacted quite badly when one of their carers wouldn't listen to them or would sort of brush over them or ignore them. I found it really rewarding to actually sit and take the time to listen to what residents were saying, which improved my listening skills but also gave me a really nice insight into their life at the care home and their lives in general. I'm rambling a bit now, but there's so many things you could say. Just pick out some key points. A different example I might use is I worked for 2 years, I can't actually remember now, at a disabled children's charity, and I was in charge of the personal care of the children, and this really taught me the importance of preserving people's dignity when you're caring for them personally. So taking them to the toilet, feeding them. Again, I also had a lot of experience of having to adapt my communication skills. So for example, there were some children that were blind or were non-verbal, so I would have to find alternative means to communicate to them. And although I did find this challenging at first, I came up with lots of strategies to be able to engage children. So for example, using sensory play. I also learnt some Makaton and blah, 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 blah. Yep, just go on talking about all the things that you learned at your work experience and how you gain things. So if you ever say something you did, make sure to follow that sentence with what you learned from it, what you gained, how you improved yourself. And so yeah, the next question, what did your work experience teach you about yourself? You actually really thrive in a busy environment. You learned that you actually were really good at prioritizing different activities, and you were good at delegating things when you were working in a team. So yeah, you can go down any route you like, just make sure you're showing what your experience taught you. So I would like you to talk to me about why you've chosen this medical school over all of the other medical schools you could have applied to. So what you want to do in response to questions like this is to really pinpoint not only the things that you are attracted to in the course or in the medical school, but why they actually suit you as a person. So for example, if you're going to say you really like the PBL teaching, you could say that you are a very proactive learner and you like to be in charge of sort of directing your learning. You also think you work really well in teams, and then you could give an example of a time when you've had to do something in a team and you found that you've really flourished. If you were applying to Nottingham, for example, you could say that the BMed Sci, so the integrated sort of intercalation really suits you because you do have an interest in research and you do want to get a taste for it. However, you do not want to prolong your studies by taking a year out to do an intercalation year. So for you then, the Nottingham course was the best of both worlds. So just make it personal to you and don't just reel off what it will say on their website about the course, because you want to actually say why you have applied there, not just why someone might apply there. What are the pros and cons of having private healthcare as opposed to the NHS? So in this question, it's another one where you want to be very careful not to fall into a very common pitfall. And that is that if you have a strong view either way, so if you really truly believe in the NHS and you think there should be no private medicine and you think that's unfair, or if vice versa, you really believe in privatisation and you think that's a really efficient way to deliver healthcare, then just make sure you're showing both sides of the argument. I would suggest doing quite a bit of reading about things like the NHS, the GMC, NICE, there's all these different things that I would suggest just having a look at. But even if you don't know that much, you can still just kind of like come up with some of the issues. So you could say, for example, that the NHS is free at the point of delivery, and that means it's accessible to everyone no matter how much money they have. And you think that's very important because healthcare should not be discriminatory. You could even bring up the justice ethical pillar. Someone shouldn't get treatment just because they're rich. It should always be fair. However, you might say that private services do serve quite an important role because actually they take away some of the stress from the NHS. So the people who are able to pay for private care will then not be taking up appointments in the NHS and using up the NHS resources, if you like. And so if they're able to pay for it, then it would make sense that they pay for their care and it will free up space in the NHS. You could also say that doctors who work in private healthcare, they often do it in their sort of free time. So a lot of them aren't just leaving the NHS to go and work privately. A lot of them do it as an extra thing. So you're not actually losing doctors by it. However, you could then say that the interest of the doctor is slightly different because there could be that sort of element of they're working for a financial benefit. So there's loads of different issues you could talk about here and just weigh them up. Come to a conclusion at the end if you like, but just show that you really, have thought about both sides of the argument before just jumping in with your answer. So I hope you had a go at just speaking that roleplay out loud. You should definitely expect a roleplay station in an MMI. If you are applying to Nottingham, then they have 2 roleplay stations. It can be hard to kind of practice for them because obviously it's hard to think of what they could possibly be. But yeah, the example I gave you is one that, maybe could come up, something similar, something along those lines. And I know role plays can seem quite daunting, but don't think of them as scary, because really you're just going to be demonstrating communication skills, empathy. Just try to be yourself. It can feel so difficult to not act up to the interviewer because obviously someone's sat watching you doing your role play, and it just feels a bit sort of awkward. But just try to actually imagine it's real and what would you really do in that situation, and just respond in a caring, empathetic way and try to communicate effectively. And that's really all you can do, and I'm sure it'll be absolutely fine. I can't really give you an example answer for this one. I guess what you could sort of have said, just to ask them, what is it that is making you really stressed about being at medical school? Is there anything I can do to help you? Trying to come up with solutions together. Have you considered getting in touch with the medical school and talking to them about it? Have you talked to your family about it? Is that something you think you might do? Yeah, you're not necessarily going in no, you shouldn't drop out of medical school, definitely stay. You're not trying to convince them to stay necessarily. You need to approach the situation as you really would a real person and just be your genuinely nice self. So that is the end of this little mock interview. I hope it was helpful. If you actually did do the mock interview and you did practice saying things out loud, please leave a comment because I'd be so chuffed that some of you have actually done that. Just tell me how it went and how you found it, and if you struggled to say things out loud or if you actually found it was okay. I'd be really interested to know, and definitely give this video a thumbs up if it was helpful, because I will consider making more sort of interactive type videos like this one. So yeah, just to bring this video to a close, I have a few sort of summary points that I think no matter what the station is, you should always have in your mind. So the first is, try to bring in your work experience wherever you can. Just slot it in, because what that does is it acts as proof, evidence that you really have shown the skills that you say you have, and you really have shown your motivation to study medicine, and you've learned a lot about the role of a doctor. So just slot it in wherever you can with little examples. Really think back to your work experience. If you haven't done so already, make a work experience log of everything you did and everything that taught you and what you gained, and just practice saying some of those points out loud. Also, just in general, back up everything you say with examples to make it more personal to you. So as well as giving evidence, I think it also makes it more kind of okay, this is a real person and not just some robot that's turned up to be interviewed. And finally, I'm sure you all know I'm going to say this, just be yourself. Don't worry about coming across as this genius or this expert in anything. At the end of the day, you're a prospective medical student. You're going to medical school to learn and to become better at the skills that a doctor will require. So don't feel like you have to be 100% perfect and you have to have done everything, seen everything. You're incredible at every skill possible. Just be honest and be genuine. And I think if you actually show oh yeah, this is a limitation of mine, or this is something I'm really working on, I think it does really show that integrity. So my communication skills didn't used to be that good, but I've really pushed myself out of my comfort zone. That's why I've got this Saturday job, that's why I did my volunteering, did all these things to help me get better at communicating. I think that is appreciated a lot more than you just coming in and saying, oh yeah, I've got the best communication skills ever. Like, you want to come across as someone who is passionate about growing as a person and learning, because that is what medical school is all about. So thank you very much for watching. I really hope this was helpful. If you have any questions, you want any help with anything, comment down below, or you can message me on Instagram. My Instagram is LucyBrettX. I've recently started posting on it like every day, and so I'd love if you checked out some of my posts. They are mostly all about medical school, especially applying to medical school, so go and check them out. And remember to subscribe to my channel for more videos like this one. Thank you very much for watching, and I will see you very soon for my next video. Bye!